Hi, everyone. Welcome to our Tuesday, February 6th edition of our we're going to call it a podcast. We're kind of calling it a podcast at this point, the way we're diving in and doing this. And so for those of you who are just watching me for the first time, my name is Jen Laurie. I am a certified holistic nutrition practitioner, have been in practice for almost a decade now, and though have been practicing health and nutrition and all the things for over a decade, and have been coaching people as well through that. And also, anyways, I have lots of experience. I've got 4 certifications, and I am just real nerdy about this stuff because it has completely transformed my health, my family's health. We have gone from the direction of heading to several pharmaceuticals being required in our lives to being the only family members. I'm talking about my extended family members that do not take pharmaceuticals, and living very healthy lives, very strong immune systems, very healthy physically, spiritually, all the things. And I think like that speaks volumes because I went from the journey. I always say I went from this extreme to this extreme and then like found a happy place, because either side of the spectrum of extremes can be dangerous, but you need to kind of veer on the side of having the knowledge and taking action, but not being like crazy, right? Because we got to live real lives in this real world as well. So that's who I am. Terry, this is my friend Terry. Terry, why don't you introduce yourself, and then we'll share what we're talking about here today.
Oh, absolutely. Thank you, Jan. So I'm a nurse, have been a registered nurse for 40 years. And yes, as much as I practice on the Western medicine side of things, and I do know that there's a time and place for pharmaceuticals, especially in acute situations, I kind of had an epiphany probably over a decade ago of just knowing how broke our system was. I was sitting as a triage nurse in an emergency room an emergency department, and just saw this little elderly couple with their tackle box full of medications and not knowing what they were taking them for, except for like, the little pink pills for the little yellow pill, because I take the little white pill kind of thing. And it just was like, oh my gosh, this isn't what I went to nursing school for. And I always had a bent towards more holistic, natural. I mean, my papers way back in the day when I did go to school, wrote a lot of them on complementary alternative medicine, CAM, we called it back then, and doing natural birthing and all that. That was kind of my thing anyway. So I had that bent. And then when I'm, down the road and I practiced for a while as a nurse, and I'm starting to see illnesses in people and the younger population that I only saw in when I started out as a baby nurse, only saw it in the elderly population, and things like fatty liver disease, but there wasn't any alcoholism associated to it. And it was like, what is going on? What is going on? And so it was like a wake up call that we needed to take a look at what we're doing as healthcare providers, I believe. And even if you're not specifically a healthcare provider, like you said, Jen, you started this journey with your kids and your family. And we all owe that to ourselves, is to dig in. And you and I know our mission here is to empower people with some knowledge. So it's maybe just enough knowledge that people will go and search out more knowledge, get answers for themselves, because that's what you need to do for your health. And I totally believe that where we're at, we're going to talk more about this, about metabolic health, but I totally believe just as we've swung the pendulum the wrong way, especially over the last couple decades, we can start swinging back again and doing the right things and getting healthier. So that's
Yeah,
me, and that's why I'm here.
we can see what we've done for periods of time and what worked and what hasn't worked. And now it's that reflection time to be like, okay, what do we need to do differently? Because there's a lot of things that we're kind of missing the mark, right?
Exactly.
And so
Exactly.
we are going to be talking about and referencing the key markers for metabolic health, We're going to reference some touch points from the book Metabolical, which I've shared with before, which is written by a brilliant doctor who has been around practicing medicine longer than I've been alive. For real. And he is just an expert in so many different areas. And he actually started off in nutrition sciences, which kind of gives him a head up on what maybe someone who didn't have that experience going into med school, right? So he kind of gives him a little bit of an extra base of knowledge going in. So it had him asking more questions along his journey. And so Terry, why don't you go ahead and remind everybody, we talked about this last week, but remind everyone what those 5 markers for metabolic health are and maybe how we test them. And then we're going to dig into each one and talk about the current treatments for that. And just bring up a couple of questions that we need to be asking ourselves and our healthcare providers. And not just going into the treatment blindly, but really having a better knowledge about what the options are with as we tackle each point of metabolic health.
Yeah. Well, the first marker is basically it's obesity, but it's not just so much the BMI as it is your waist circumference. And so measuring the true circumference around your middle section, not below where you're large, but where you are large. And if you're 40 inches or greater as a male or 35 inches greater as a female, it's a very high indicative marker that you've got some metabolic issues going on. And then our fasting blood glucose levels. And those, we have some numbers we can talk about here in a bit, but that's one that can be measured either like you can do a finger stick, you can do a continuous glucose monitor, you can go in for testing in your labs as well and have that one taken. And then another one is your blood pressure. So oftentimes people don't associate blood pressure, elevated blood pressure with metabolic issues. They think of it being more like, oh, my family had this, genetics. The doctor told me to decrease the salt intake. So we'll touch on that a little bit too, but many times, and more of what we're reading, especially from Dr. Lustig, is more often than not, it's related to metabolic dysfunction, not so much anything to do with salt intake. And then the other ones are your cholesterol. So you can measure those with your LDL and also measuring your triglycerides. And I'm thinking I'm missing one here, but
no,
we can
that's
also
right. That's right. Because
yeah.
we break the triglycerides and cholesterol out because they are
He
two
does.
different
Yeah.
markers.
Yeah.
They're in the same area of like when you're looking at your blood work, they are kind of in the same section, but they indicate very different things that going on in your body. So it is
Exactly.
important to look at them as two completely separate numbers. It doesn't mean that there's not an interaction between the two, but we're going to talk about that. So we're going to start with the big elephant in the room, obesity, okay? Because, there has been I'm just going to speak freely here, but there's been a whole movement on loving your body where it's at. And I'm all for that. However, if it is restricting your movement, if it is causing health problems, and if it is causing any sort of symptoms, we've got reason to say, that's not loving your body.
Mm-hmm.
We need to do better. We need to have higher expectations and address the causes so that we can start turning it around for the health of our next generations, right?
Exactly.
Because now we're seeing this problem pop up in younger and younger people, and it really is a dysfunction of what's happening in the body metabolically, and we need to tackle it and get to the root cause of it.
I think too, just on that real quick, is sending out a message of hope here, because I think a lot of people have gone into the whole, have gone that direction of body image, love my body just the way it is, out of some frustrations of feeling like they've just been told to exercise and diet and help your body. And now we're finding that that is not the answer. That is not the direct answer. Yes, exercise and diet is very, very important, but that is not the direct answer. So once I think people start hearing the real root cause and what they can do, then they can grasp that for themselves and realize just what you said, love my body by taking care of it and not getting frustrated by somebody just telling me, oh, you need to just push away from the table. That's not the issue here. That's not what we're talking about. So I think that makes a huge difference.
I said that we were going to share some facts here. So I've got a statistic to share right here. Okay. So 80% of the time when it comes to being overweight, obesity, 80% of the time is typically someone who is experiencing metabolic issues. 20% of the time, people can be larger and be metabolically healthy, and there just might be something else. So there's always exceptions to the rules, always. But right now, what we're talking about is that 80%. We're talking about that 80% of the population, just so you know. There's so many great things in this book, but we're going to talk a little bit about well, I guess one of the things that really stood out to me in this section is he was talking about, because he was working with pediatric patients, and he was talking about how very easily at that young age it can be turned around just by removing processed food. Like that one thing, that it made very significant changes in the markers. Even if it didn't decrease their weight, it decreased the risk factors. I thought that was really interesting.
Yeah. Yeah. So when you get into looking at metabolic health, you're looking at the cellular energy, and that you have your energy stored in the right cells that are meant to have it be stored in. And when you're in poor metabolic health, the energy is being stored as fat in the wrong places. I mean, that's kind of just a cut and dry bottom line. If somebody says, well, what is metabolic health? And so when you start to see at the cellular level that the cells aren't accepting in the energy, and then it's starting to be stored somewhere else as fat, you start to see the whole cascade of events, which ultimately can lead to one of the things is obesity. And so, yeah, we can turn that around by helping those cells become more, what do I want to say, more accepting of insulin, because they've become resistant to insulin, is a big portion of this, a huge portion. It's the primary thing. And so when the cells now start accepting the insulin to help convert the glucose into energy again, yeah, you can start seeing things move. And you can, once you've become insulin resistant, you can turn that back around. That's the thing that is the beauty, the hope of all of this. Yeah.
Yes, so much hope in that. And I want to just add that metabolic, if someone is experiencing metabolic dysfunction, obesity is not always one of those indicators.
Right. You can be normal weight.
Who are perfectly fit and thin that this can happen to, because it's a chemical dysfunction in the body. Right? And so I just wanted to add that piece, because that is another flaw with using this as an indicator. Because if someone comes in and they're not obese, it's going to be like, oh no, they can't be metabolically ill. And then they're not necessarily going to get pointed in the right direction for the metabolic health treatments or things, right?
Yeah. Yeah. And that's why too, I think it's so important. And we can talk about this today or another day, but there are some other lab values that should be looked at that oftentimes not even drawn, not even considered. By themselves may not be very accurate or very great indicators by themselves. So they haven't been used, but when they're put together with other lab markers, it gives a bigger picture. And so I think people becoming more educated about that and what they should look for when they are seeing a doctor and asking about their labs. Also, not accepting it when the doctor says, oh, all your lab values are normal. No, look at the actual numbers, because then you want to talk about optimal health, and that is different than normal levels. So, and I know we've touched on that before, but again, just reiterating it for anybody who hasn't heard this, is there are some things, because you're right, you don't have to be obese to have metabolic dysfunction. But if you're feeling fatigued, you're crashing after you eat, you happen to check a blood sugar and find out you tend to run high, or like for my husband, he gets a big dump of insulin and then he drops really low and he crashes and he has to sleep for a while. I mean, it's all related to that. So when you know there's something not really quite right going on with your energy, trace it back, because that means the cells aren't working the way they should be working too.
Yeah, so in this section, he's really coming forward with the idea that we need to stop worrying about the weight and look at the metabolic health. And then when we get the metabolic health addressed, the weight comes off naturally. So the statement he makes is their insulin didn't go down because their weight went down. Their weight went down because their insulin went down. And we're talking about the insulin that just sits in your bloodstream and isn't able to be utilized because of insulin resistance.
Yeah.
So
if somebody thinks about it, kind of like a lot of people are more familiar with antibiotics and becoming resistant to certain antibiotics. Like over time, the certain bacteria out there, and we've developed some nasty ones that are resistant to antibiotics because we've used antibiotics for so long. So they kind of like, now they're like, yeah, you can use that antibiotic. It's not going to do anything to me. Same idea with insulin. If the body has had insulin being dumped in, then the cells begin at the receptors to not be as sensitive to that insulin and even resistant to that insulin, and not letting it do its job of converting glucose to energy at the cellular level. So yeah, I love that quote where he says it about the insulin and the weight. I think it's worth bringing up too, because we're going to talk about treatments that don't help. So smack in the face for everybody about this right now, because it's the biggest thing going on in the United States and Canada and worldwide, probably even. I don't know the worldwide statistics, but it's huge in North America, are the medications that people are taking, thinking that all they have to do is lose weight, and like you have said, Jen, you pay for it, or you may lose 20 pounds now, but you're going to pay for it down the road because you're going to lose 50% of your muscle. That's a given fact with these peptide
digestive system. So you're not going to
be and these are not right. Well, and these medications are not natural. I had somebody challenge me one day that these are natural peptides. No, they are not natural peptides. They are synthetically pharmaceutical made to mimic our peptide.
Well, is this not true though? Like they wouldn't be able to patent it and profit from it if it was natural?
That, I don't know. That could be. I just know
that's my understanding, is that's why like they can't go in and like do the same thing with natural substances. And there's a whole thing about that. I'm probably not like,
well, I just know that it's not a biologic. It's not a biologic. And so biologics fall into a category of where they're derived. They may be changed enough so they can patent them, but they are derived from a natural source. These are not derived from a natural source. They are created. And the peptide chain they create is actually a little different on purpose, I'm sure. It's kind of like eating GMO food. Would you say, well, if it's genetically modified, it's okay? No, this has been modified. It's not okay. And
the body won't recognize it and know what to do with it. Is one of the key points when it isn't natural, is the body doesn't always know what to do with it. It doesn't recognize it. And it can contribute to the toxic load in the body and also cause dysfunction in other areas that you don't think it's targeting.
Yeah. Well, and it puts your body into starvation mode. And so when you put your body into starvation mode with these medications that are being so freely used,
Or weight loss.
because we think, and then we're back to the treatment thing, because we think we need to get rid of the fat first. So if we think we're going to get rid of the fat first, instead of getting down to the reason why there's a problem with the weight, then it looks like a great treatment because it's helping you lose weight. But then in the process, you're causing all these other potential side effects, and real outcomes of just, taking your muscle mass down. And anybody over the age of 60, which I fall in that category, anybody in the age of over 60, you cannot afford to lose 50% of your muscle mass. You can't.
So
You will die sooner.
I
It's
will
just,
argue at 40, that's a big deal too.
yeah, well, it's important anytime. It is important anytime. But as you age, it becomes so much more important because
At
that's
40 is when we just start to we start being like aware that we need to actually build this lean muscle if we want to stay healthy and live long and healthy, right?
right. Right. So
Oh my
yeah,
God.
that's one of those things where it's a lie. This treatment is a lie, and it makes me so sad that people are
It's
buying
not
it
a
hook, line, and
long-term
sinker.
solution, that's
Yeah.
for
No.
sure. It
Nope.
is adding a big amount of money to the bottom dollar of the company selling it. That's it. Okay, so let's move on to cholesterol.
Hmm.
Because a lot of people don't know. Okay, let's differentiate. We've got LDL, we've got HDL. I always think LDL as loser cholesterol. You don't want it. Loser
I like that.
cholesterol, right? And then your HDL is like your good cholesterol, right? And
Hmm.
so there's important factors in that. First, you need to have a healthy ratio. So the number by itself doesn't always mean risk factor. You have to look at the whole picture, first of all. And the second thing that Dr. Lustig really points out is the fact that there's two types of LDL. And
LDL.
a lot of people don't know that there's two types of LDL. And we're using you guys, you know it. How many people are on cholesterol lowering medications, also known as statins? How many people are on these younger and younger because they're looking at the LDL, but they're not breaking it out to the two different things. Now, it's also important to note that our body will make it if we don't need it.
Yeah, if we don't have enough, our body will make cholesterol because we need
Yeah,
it. It's so
it's made
important.
in your liver,
It is
guys.
so important to
It's
have the
made
right
in your
amount in your.
liver.
Mhm.
I just want to add, it's not in this section of the book, but your body will make more of the unwanted types of cholesterol with sugar in your liver.
Ah,
Mhm.
yeah.
Anyways, we're not going to dive into the sugar thing right now because I want to go into because basically often I think things have shifted a little bit, but the initial when we really started in the medical world started addressing cholesterol, it was go on a low fat diet,
Mm-hmm.
right? What else would it be?
Go on a low fat diet and get your medication. And we're still seeing that. We still see that a lot. And it's supposed to be the answer for helping cardiovascular disease.
But what we're finding is that the bad cholesterol is the one that our body will make. It's not from our food. And when obviously I'm talking about healthy fats. I'm not talking about
Right.
trans fats coming from potato chips and stuff like that. I'm talking about healthy fats, fat in avocado, olive oil, coconut oil, all the good fats, okay? Cold pressed organic oils, like they're so good for you and you need them
Yeah.
because where are you going to get your fat soluble vitamins and nutrients if you're not eating any fats? And those nutrients have pathways in your body that need for functioning, right? Okay, so one of the things that I found, now I kind of knew this already, but the way he describes it is just so good and crystal clear in this book, right? So he talks about how the prescription for a statin will inhibit cholesterol synthesis. So it stops our ability to make it, yes, but it is only targeting one type of LDL.
Yeah. Yeah.
And it's the one that doesn't cause an increased risk for heart attack, stroke, all of the things that cholesterol is associated with. And so here's the problem is like you know, if we focus on this medication that now they've, studied it and know that it's not even targeting the right type of cholesterol because some people genetically have high cholesterol, but it doesn't mean that they have increased risk factor necessarily.
Yeah. I mean, it has to all be broken down. You have to do more than, like you said, just read the one type of LDL and know what your risk factors are with everything combined together, not just one thing.
One of another more stats, because it's not an exact stat, but he talks about how fewer people are dying of heart attacks because of medical technologies. This is good, but we're seeing more people having heart attacks. Like, I don't know if I'm going to look and see if he has, if I've got some specific numbers, because I like numbers.
Yeah. I like
numbers.
numbers too. I didn't write it down, but he does.
Perspective when we have the numbers. So I'm going to look for the numbers while you talk. But just the fact that more people than ever are suffering from them. And it doesn't mean that there's not long-term side effects that happen after. And so what can we be doing to prevent them in the first place is where we need to get. Go ahead and share what I know you've got something to say here. And I'll look and see if I can quickly find a couple of like numbers.
Yeah, I think that the main thing I would have to say here is just there's so many, again, we're right back to, are you going to take something that is going to lower the synthesis of cholesterol in your body, but potentially create more problems in your liver? And I mean, everything from liver cancer to different things have been seen with these drugs. So
yes,
what's
it even says the specifics of what these statins cause. So I will read it from here. This is not my opinion.
Not our opinions here.
Actual facts being shared by this medical professional. He says that statins increase glucose intolerance and increase that risk for diabetes and weight gain. Well, how is that tackling the metabolic problem? Right? So the other side effects are muscle breakdown. We just talked about that. Kidney failure, holy cow, scary. And then again, type 2 diabetes. So those are the main risk factors with taking statin drugs over long periods of time, which is not addressing the cause. It's not tackling the problem. Perhaps it's creating more metabolic dysfunction in the body. Holy cow. And his opinion, not mine again, is that statins would not reduce the risk of heart attacks across the board. He says without a doubt, they are not reducing the risk. And that's going from data that is showing that more people have heart attacks now than they did before, and more people than ever are on statins. So it's clearly not doing its job the way we hoped it would.
Yeah. I think it's really important. I mean, in all of these things is, and he says this, there is not a medication out there that cures any of the chronic illnesses. So why are people on these for long terms? We have to stop and ask those questions. And it's okay. You should be, if you have a provider who is taking care of you, you should be able to ask those questions. Like, what should we be doing to help me get off these? Because being on them long term isn't taking care of root problems. And we've got to get back to root problems, root causes for things if we really want to be healthy. So,
Well, and he mentions that globally, I think this is somewhat current. Globally, pharma companies sold patients and doctors close to 1 trillion worth of statins. Big money.
big money. It's a
Big,
big, yeah. There's
big.
hardly anybody anymore
And it
that
also,
isn't on them.
he also talked about how the insurance companies love it because it also allows them to say, hey, you have a condition that already is in your body. We can increase your rates for insurance.
Wow. Yeah. Yeah,
Right. So it's this whole broken system, right? I'm just
for
looking here.
sure.
Oh my God. Oh my gosh. Okay, wait. Close to, okay, that was worldwide, the trillion, 400 billion in the US alone.
Wow. And
So
people
it's
need to stop and
clearly a
really look at
problem
what,
everywhere, right? It's clearly a problem everywhere, not just in the
yeah,
US.
yeah. And people need to stop and look at what a billion and a trillion really mean. I mean, we throw those numbers around anymore because our
Oh,
countries have these deficits and we don't get what it is. But when
he
somebody has a
also,
minute to do this, if they haven't done it, have them go look up how many seconds is a million seconds, and then how many seconds, how much time is a billion seconds. And
yeah,
it'll start giving you that idea of what we're talking about in money or in the number of people who are unhealthy with something. Because otherwise, we throw these numbers around. I think people just like, poop, we've gotten desensitized.
that's right. And so one of the things that he shares in this specific context of statins is in the studies, basically it is increasing like the improvement of life and like the longevity of life by 4 days.
Yeah,
4 days
4 days.
should
And yet you
everyone
might
take
get
a
something worse.
statin so they can live 4 days longer?
Yeah.
Oh my gosh.
Yeah.
So crazy, right? Okay, we got to move forward here because
Yep.
we're going to take way too much time. But I know that we have such great information. We don't want to like cut out anything that's really important either. But really, what he's saying is statins give an illusion of protection against these because we see the numbers lower, but it's not that we're not lowering the right number of the actual risk factor, which is where we're not seeing that crossover. And he's really talking about a lot about we need to tackle the insulin resistance problem that's happening in the body. So let's talk about blood pressure next.
Sure.
Okay. So what is a blood pressure we're looking for? What's a healthy blood pressure?
Well, textbook ideally, 120 or lower for your systolic, your top number, 70 or lower for your bottom number. And that's getting changed. I think it's interesting that, and he points this out, Dr. Lustig does, that as we've developed more high blood pressure medications, that the numbers that we want to look for keep changing too. So,
hey, Christy did some math for us. So I'm just going to interrupt for just one sec. Christy
sure.
did math for us. She says 1,000,000 seconds is 13 days. 1,000,000,000 is 31 years.
Yeah.
Oh.
Isn't that insane?
That math is correct. I'm trusting it's correct.
Yeah.
Wow. Anyways, sorry.
Yeah.
Continue
So
with
I've done that before. That sounds right because I've done that before. And that's why I wanted people to get that because we just throw these numbers around and we're like, yeah, a million, a billion, and it's like, there's a
you
huge
don't
difference.
realize how much bigger a trillion is than a
Yeah.
billion.
Yeah.
And how much
Exactly.
bigger a billion is than a million.
Yeah. Exactly. But back to blood pressure medications. Again, bottom line, I'm just going to say most people are walking around, unless you're in the end stage of some long chronic disease process, like, if you're into type 1 diabetes for a long time, you may have unhealthy kidneys, a kidney system that is unhealthy. Most people, though, unless they have specific kidney issues or chronic illnesses for long term that affect the kidneys, most people walking around have good kidneys. And when you have good kidney systems, your body automatically adjusts for salt intake. It just does its thing to keep homeostasis, to keep balance. And so the long-term thought of, oh, well, it's salt in the diet is causing your high blood pressure is not,
yeah.
it's not where it
Oh,
starts.
I'm gonna direct quote him on that. So we
Yeah,
can
please do. I mean, because I don't have those numbers in front of me like you do. I don't have my physical
but
book. Yeah.
here's a stat for you guys. And Christy just updated us. Its trillion is 31,688 years.
Oh my gosh.
Oh my gosh. Okay. In
Wow. Thank you, Christy.
yes, in 1974, 53 million Americans had hypertension. The number has now doubled to 100 million Americans. Guys, that's a third of the population.
Mhm.
It's a third of the population. It's insanity. And like we're talking about a third of the population, including the population of kids and teenagers that may not have these problems, which means it's more than a third of the adults.
Mhm.
Like it is crazy. So I've got a couple other numbers, and that was okay. So in the years between 1988 and 2017, the percentage of hypertensive patients taking medication quadrupled from 7% to 31%.
Yeah.
I'm gonna let that sink in for a
Yeah.
minute.
That's like,
Okay. And that was even after they expanded what is the healthy what is healthy blood pressure, right?
yeah. Yeah.
Woo-wee. So they and this is just I just thought this was just a fun fact is that years ago when they were testing blood pressure and trying to see what was considered normal, they used so this is like 50 years ago, they would take your blood pressure and it was what they were looking for was 100 plus your age. Interesting, right? So in a 40-year-old, the systolic number would be 140, say. But now it's dropped to it dropped in the 1 to 130 in the 1980s as hypertension treatment started flooding the market and Big Pharma advocated putting more people on the drugs.
Yeah.
And
It's
now
actually
hypertension is actually the number one risk factor for death globally, not just in the US, not in like globally. Number one risk factor. Okay. I
yeah.
think
So
like
cardiovascular health, which high blood pressure falls in under, is the number one killer of men and women worldwide. So yeah, we have to get back to again, I mean to beat the dead horse here, but it's getting back to the cellular health. It's getting back to metabolic health and what's going on because there's a whole and because of time we won't go all into it, but there's a whole series of chemical things that happen in your body that are more apt to be behind why the blood pressure is going up. We're not talking just
bigger picture,
genetics and we're not talking salt in your diet.
bigger
So,
picture. So he says the first problem of tackling hypertension because you can lower blood pressure in anybody with enough medicine. Lowering
mm-hmm.
actually hard to do. The problem is the side effects. So
And
you go,
sustaining that. Yeah.
it's always a side effect. Like we're always gotta listen to the side effect, right? So you could experience weakness, dizziness, fainting, muscle cramps, vomiting, or develop electrolyte imbalances. Well, you can imagine what developing electrolyte imbalances could cause, right? So I always just wonder when someone comes to me with symptoms and they're on a load of medications, I'm like, how many of your symptoms are actually caused from your medications? What medications do you actually need to be on? Like your life depends on it. And how many of them are actually just causing more problems in your life?
Yeah.
It's a hard question to ask, right?
Yeah.
It's a
Right.
hard question to ask. It's a harder question to answer, but it needs to be asked because we got to get back, right? We got to back up a little from where we're at. So yes, lowering blood pressure is a good idea, but how we do it is the important factor.
Mm-hmm.
Okay, because we don't
Mm-hmm.
want to add. So he is actually saying that many people who go on these medications later in life. So as we age, it actually, he says it can actually cause more death due to accidents happening from the fainting, the dizziness, the all these things.
Yeah.
And it can actually cause more injury and death in elderly patients, specifically elderly patients, than the problem itself.
Yeah.
So
Yeah.
interesting.
It is interesting.
Okay, so obviously changing diet is really important when we're
Hmm.
talking about um, blood pressure, but here's where we can talk about a little bit of the salt that we're talking about, right? Because you
Hmm.
said salt. They say go on a low salt diet, and that's not always the answer.
Hmm.
Not always the answer. But I did want to say that it is it can be a contributing factor, because if you're eating a lot of processed food, fast food, you are going to have excess sodium, and it can contribute to the problem of your blood pressure. I just want to
Yeah.
say that it doesn't mean that you can just eat all the salt
Right.
in the world
Right.
and it's not
Yeah.
a bad thing. We
Right.
still need to be mindful of how much sodium we're consuming, but cutting all the salt out isn't going to fix everything either. So I just want to just share this, because we know that food in the UK very different from food in Canada, US, right? Our same manufacturers are making different formulas for there than they are over here. Like that, if you guys don't
Hmm.
know that, look into it. Look into it and see what your cereals are made up of here versus if you go shop over there. It's very different because the standards have changed over there, and they've kind of held on to actual health over there a lot better than we have over here. So the UK documented a 40% reduction in stroke between 2006 and 2012 via a simple public health maneuver by forcing the food companies to reduce the amount of salt allowed in processed foods. So yes, salt
Yeah.
can be a contributing factor. And here's the thing, it cost the UK nothing to do that. But you know what it would have cost them had they not done it? This is what's stated in here is the cost of medications would have been about $3.3 billion in that year that it
Wow.
went,
Wow. Yeah.
right?
And salt is contributing. It is, I'm not saying it doesn't, but
Mhm.
so many times instead of getting back to what all is going on, I mean, there's just such a cascade of events with healthy insulin, insulin resistance, cellular energy, all backs up.
So he acknowledges that right now, the what is supposed to be a healthy amount of sodium is considerably less than what our ancestors consumed,
Huh.
because they had cured meat stuff,
Mm-hmm.
they had to, in order to preserve, because we didn't have global access to food sources and stuff like that. I live in Canada. I don't think, if when we didn't have to transport fresh fruits and vegetables, our people had to have ways to process and preserve, right? And a lot
Mm-hmm.
of those the preserving had a lot of sodium in it, right? Sodium is a natural preservative, right? And
Right.
so, but here's where he says where we're different, and the reason is because our kidneys could excrete the excess sodium. So if your kidney function is really good, you are totally able to excrete the sodium, and it may not be a problem as long as it's not extreme
Right.
sodium
Right.
intake. Okay. So it says there's one thing that inhibits sodium excretion by the kidneys. Are you ready for it?
Mhm.
Insulin resistance.
Distance.
Are you
Right.
shocked? Are you
Yeah.
shocked? Are we seeing a reoccurring theme of what
Yeah.
we need to get to the bottom of, and what we need to really start addressing? That's it. High insulin levels increase because of blood pressure. Wait, high insulin levels increase blood pressure,
Pressure. Yeah.
right?
Yeah.
So even with relatively low sodium intake, if you have insulin resistance happening in your body, it could be the cause of your increased blood
Yeah.
sugar.
And that's what I was trying to say. I mean, don't just think, oh, because you
Mm.
can cut your salt down, you can eat right, and then still have the insulin resistance going on and still have the elevated
Big
blood pressure.
picture.
And then you're wondering why. And then sometimes people are just like, they'll throw their hands up and be like, oh, must be genetics. My father had high blood pressure. My grandpa had it. Well, 15% of most of the chronic illnesses are related to actual familial reasons, family reasons.
Yeah.
The other 85% of it is not. And but more environmental, maybe from family than actual genetics. But because your grandma cooked a certain way, who taught your mother to cook a certain way, or your dad, and now you cook that way or eat that way, that's been passed on. That's more environmental. And so,
I've been talking about that for years because people are like, oh, I'm just going to have this because my parents had it. And it's like,
yeah,
no, but it's not. You can be predisposed even to something and you can change the outcome.
yeah,
It's because we adopt the habits of the people around us. And so, inevitably, because if that were the case, I'd be really in a bad place because, like, my grandparents barely made it to 60 with
yeah.
all the diabetes, cancer, all the things, right? So if you want to
Mm-hmm.
look at predisposition, I've got my blood work done with my predispositions. If I don't take care of my body, I'm just going to follow the same path as my ancestors. But it doesn't mean I am inevitably going to land in the same place as them
Exactly.
health-wise. Tracy brings up a good point here in the comments here. She says, what happens is they reduce the salt and increase the sugar when they do that in processed food. So like processed.
Exactly. Just like the fat, anything that the fat's reduced in, increased sugar. Same. Exactly, Tracy, because of taste. And
Mhm.
then it's addictive. And now we're addicted. The same part of our brain that gets addicted to opioids and
On the same
harmful
thing when they
is
put
the
low
same thing
fat.
with sugar.
Low fat
Yeah.
was up the sugar too. The answer
Yeah.
to low fat was up the sugar too, right?
Yeah.
Oh my gosh. It's fat, sugar, salt. If you guys want a good book to read to learn about the processed food industry and like what happens behind the scenes, get out. I'm looking at my bookshelf right now. Salt, Sugar, Fat. It's called. It's an easy read. It is
Who's
phenomenal.
the author on that one,
Like
Jen? Can you see it?
Michael Moss, sorry.
Michael
Michael
Moss?
Moss. Yeah, Michael
Okay.
Moss. Yeah.
Yeah.
I actually was able to hear him speak at a conference. It was absolutely phenomenal. So I went out and got the book before I was like, I got to read the book before I hear the speaker speak. Cause then I understand you get more out of the person who's speaking if you go read their book before you hear them speak. Right. So I got to meet him and that was really a phenomenal experience because that book made a huge impact in how I looked at processed food and it actually really made me not want it.
Mm-hmm.
So I
Mm-hmm.
was like, after I read the book, I got a little extreme for a moment. So there was like a hot minute where I was like, if anybody reads this book and can even put processed food in their mouth, they're crazy. They're crazy. Like, how could you want to do that? So, what was the name of the doctor for the first book? Oh, Dr. Robert Lustig.
He also wrote, Dr. Robert Lustig also wrote Fat Chance. And
Yeah.
that, again, it's kind of in that
You
same
get in
vein about,
Amazon, you can get a like two for it's not
yeah,
two
get
for,
it.
but you
He
can get
really,
both.
yeah.
I got both books, so this is the one I'm starting with. But yeah, I recommend. He's so brilliant. He's so brilliant. New bedtime story for my youngest. Oh, Tracy.
Teach them while they're young.
Right? Okay, we've got one last topic to hit here. It is blood glucose. Hello, we've been talking about insulin resistance the whole time, really, because it's all connected. It's
It is
all
all connected.
connected.
Funny how that works.
We're going to wrap this up going into the blood glucose, but really what we want to talk about here is what are the treatments that are happening? And again, are they the best thing for everyone? Because
Yeah.
they're being given to everyone, but are they the best option for everyone?
Yeah.
Okay.
Yeah.
So, some statistics for you. So just not statistics, just the facts here. If you have type 2 diabetes, which can be, I don't know if I'm allowed to say it, but can it be reversed? Like, is that the wording we
Well,
use?
there's things you can do to address your metabolic health that are going to impact it. Let's just
Thank
say
you.
that.
Thank you for wording it. Okay, we do
Yeah.
have we can
It's
play it.
different than type 1 where your pancreas isn't putting out the insulin.
Yeah,
This is different.
it's a
Yeah.
totally different function. I wish they came up with like a completely different name because the
I know.
function mechanism in the body is totally different. It's not even the same thing.
And it has the word diabetes has nothing to do with sugar. It has to do with I think it's from Latin or something. It means siphon because when you develop diabetes, you have to pee like a racehorse. You just have to
God,
pee
I
and pee and
didn't
pee.
know that that's
Yeah.
where the
So that's,
name came
yeah.
from. Okay. Learn
I think
something.
I got that out of one of his books, Dr.
Okay,
Robert
I'm not there
Lustig.
yet. I'm probably not there yet. But anyways, you do also increase the risk of other things. And that is why it's important to get the diabetes under control, is because you are also risking how do you say that?
Retinopathy.
Thank you. Retinopathy, neuropathy,
Yep.
and nephropathy as well. So we're talking about eyes, peripheral nerves, and kidney function. Like it
Yeah.
affects all those functions, which it's got to you got to kind of start connecting the dots as you're seeing us piece this together. Like uh, it- retinopathy, like we're talking blood pressure can be affected with that, right?
Well,
Neuropathy.
and if you stop and think about it, what's happening, it's all has to do with circulation, and
Yes.
blood pressure has to do with circulation.
And kidneys
So
able to release sodium and all the things,
yeah,
right?
it's mhm.
Okay. Okay. A couple of things that I had here. Of course, we've got like, what is like, as soon as you go in, your blood sugars are too high, you get prescribed a medication,
Mhm.
right? Some
Mhm.
people can go in and have like pre-numbers and be like, please give me time to work on it before I have to take this. I want to empower you all to understand that nobody can force you to take anything. You are always the one who has power over your body. Because I have people who will come to me and say, my doctor is making me take this. You always have an option to investigate, to ask questions, to get more opinions, and to make changes in your life that can make an impact on your health. So work with your doctor. Don't just follow your doctor,
Yeah. Have
right?
a say, have a voice.
Yeah, work with them. Absolutely. Utilize their knowledge, their experience. But remember, ultimately, you need to advocate for yourself because they're very busy and they got lots of patients and they have one direction of treatment path that they've been given to take you on.
Yeah. Yeah. I
Right?
thought it was really interesting recently, and you and I both heard this, but from a woman whose husband is a doctor. And I've read in some places, I haven't really worked in clinics to know their timing, but she said her husband has like 15 minutes to see a patient. A lot of times you'll see and read, and I think Dr. Lustig points this out, is they've got 6 minutes. It depends on the clinic and how many patients they're supposed to see. They're coming in and checking the boxes real quick. And I'm not saying doctors don't care and they don't have the knowledge, but this is how our system works now.
It's a
And they only have so much time. So you
Mhm.
have to be an advocate for yourself. And um, oftentimes, even this particular person who said this, she recommended, if you're looking at doing some things towards wellness practice, is getting into some places, into practices, into clinics that are wellness focused because they will take more time. They have more time, and they can work in harmony or together with you and your doctors. I'm not putting down doctors. They don't have the same time. So you can't go in with an expectation that they're going to sit there and talk to you for half an hour to an hour, typically, because they also know then now they've just backed up the waiting room. And
Right.
now they have all those patients to see
And
that they're
I,
still going to
I
have to see.
hands down, I would not want to be in their shoes. That's for sure.
No, I mean, it's
Um,
too bad it's that way now, but it
So let's
is.
talk a little bit about what Dr. Lustig says about the side effects, okay?
Sure.
Remember, they're not my words, these are coming straight out of Dr. Lustig. So he says that the potential side effects of these medications that are being used um, include dizziness, drowsiness, heartburn, which is an indicator it's affecting digestion and the ability to digest your food, specifically proteins, and proteins are necessary for healing processes in the body. Gastrointestinal distress, hello, still more digestion, right? And if we ruin our digestion, where's the nutrients coming from? I just might add, like, where are the nutrients coming from if we're not taught? Anyways. And seizures.
And what was it?
And seizures.
Oh.
Seizures.
Hmm.
I didn't know that actually. I knew the other things. I didn't know that it can cause seizures as well. And he states that the side effects of glucose lowering medications are responsible for 100,000 ER visits in the US per year.
Hmm.
Every year, 100,000. Crazy, right?
Yeah.
So he says that the meds are treating the symptom, not the cause.
Well, and that's the thing. We're back to it again. That's true about all medications. So when you feel like you've been prescribed something, it's not because you've been prescribed to cure what you have going on. It's treating the symptoms of what you have going on.
Okay.
And so being on these things long term isn't changing your condition. It's just changing the symptoms. And sometimes those symptoms become worse and you need more medications because of the side effects that they bring on. So it's worth digging deeper, is what I like to say. And we need to dig deeper. It's apparent. Our statistics are staggering for the numbers of people who are, like you just quoted, hitting the emergency rooms and the amount of money spent on pharmaceuticals and everything else. And yeah. So we're kind of hitting just the tip of the iceberg
It
here,
says
but
we're insulin resistant and adding extra insulin lowers glucose only at the expense of contributing to chronic disease. So if we're only kind of tackling it in this way, we're not necessarily improving the situation. I'm looking for the his statistic of how many more people have these problems and like that it's not necessarily correcting our problem.
right. Well, yeah, he does quote statistics for where we were at with our numbers of diabetes, like in the 70s, and then it, like quadrupled in X amount of time. It's just the numbers are staggering. I don't have
Okay.
them in front of me.
One of the things he says is that high blood glucose is the symptom of the disease, not the
Hmm.
disease itself.
Hmm.
It's just a symptom, right?
Yeah, like obesity is a symptom of the disease. It's not the disease. It's not like if we can get people to not have obesity, they're going to get well because they can still have metabolic syndrome if you don't take care of the
Yeah.
root
Okay,
problem.
here we say that in the US alone, the expenditure in diabetic drugs, monitors, and treatments reached $350 billion last year, and that is 10% of the overall healthcare expenditures. That's crazy. Isn't that not just like so crazy? And so we're talking about like, should we be treating the symptoms or reversing the disease? It's metabolic. So we're talking about metabolic health. So we're not just talking about blood sugar right now, but metabolic health in general is 75% of the total healthcare budget. Okay,
Hmm.
so it really puts it in perspective how important metabolic health is and how we need to look at it. And the reality is, my phone died over here. The reality is that there's so much we can be doing for metabolic health that is without side effect, that is, things that we can do. And in the long run, it saves us money, it saves our health, it gives us quality of life, it gives us more time with our families. And so if we were to share, we didn't talk about this ahead of time, but because we're going to close the call here right away, but if we were to share, like, I don't know, five things that a person can do to start
Hmm.
making strides in their metabolic health, I would say one is drinking more water. I
Hmm.
am alarmed at how many people say, well, I don't like water. I'm like, well, you can't live without water, so learn to love it. Find
Yeah.
something
Yeah.
like, and don't put chemicals in it. It's going
Yeah.
to add to the
Squeeze a
cost.
lemon, do something.
Yeah, squeeze the lemon, mint leaves, cucumbers,
Yeah.
whatever,
Yeah.
you know, put something real in it that
Yeah.
has flavor if you must, or drink herbal tea. Like there is things you can have to bring the hydration back into your body so that your body can be flushing properly. That's one thing that's really, really important. Another thing would be to move your body,
Mm-hmm.
your body. Now, moving your body can be a bit of a struggle if you're dealing with chronic health problems at this point in time. But there is a number of things. Terry and I are very aware of how impactful the supplements, the whole food supplements that we have. If you want a list of what tackles those chronic issues, we can give you lists of those. But one of the things that I think would be most important would be like our enrich, which is the digestive enzyme probiotic, because we got to get back to like root cause gut health,
Yeah.
right?
Yeah.
And I
Yeah.
think there's
Start.
oftentimes needs to be some repair happening if we've kind of been led down the path where we've maybe taken some things or done some things that have caused some digestion system issues,
Yeah.
right? The
Yeah.
second thing on
And
that topic of
mhm.
supplementation, I would say would be collagen because it's the building blocks of the body. It
Right.
really is
And it
building.
really helps with your gut health. It helps with your joints. It helps with so much. Yeah. Yeah. If you're talking about trying to get moving, I mean, it's a difference maker. It really
Yes, so
is.
it can add to go back to step 2 of what you can be doing. It can increase your mobility
Mm.
like crazy, reduce pain and inflammation in the body, joint health, all those things. It can really help get you moving again. Now, I said 5, so if there was 2 other things, I'm going to leave those ones for you, Terry. I took the easy route and
Yeah.
picked the top 3.
Well,
What-
you know,
What's the
our
last?
diet is a big part of it. I mean, and
Yes.
I'm not talking dieting like fad
No,
diet or
it's
cutting food
reducing,
out.
I think reducing processed food in
Yeah,
general.
I was going to say shopping the perimeter of the store. I'm assuming in Canada it's set up pretty similar to how we are here, that the perimeter of the store is your fruits and vegetables, your meats, your different things that are more your natural, not
Yeah.
processed
Along
foods.
with food, the food topic, because that needs to be in our top 5 for sure. Um, you know, do those whole foods for sure. And then for anything that you're buying that has a label, get real good and educated on how to
Mhm.
read labels so
Yeah.
that you can stick to foods that are minimally processed and maybe stay away from the ultra processed foods. And that can be a whole nother topic for another day
Yeah,
on.
because that's a hard one because they don't have to say how they process it and what they've done to it. But one of the things you can do is read the label and understand there's, you know, what, 23 plus different ways of saying sugar.
Yeah.
And even saying, even for instance, I do eat yogurt. I'm not lactose intolerant. I take my enzymes and I'm fine with that. It doesn't bother me. But so for those who do eat yogurt, don't get a yogurt that's been sweetened with fruit juice. That's horrible. It's
Or
horrible.
even worse, sweetened with artificial sweeteners.
Or artificial sweeteners, fruit juice, because you're getting the fructose.
I
Yeah.
think we're
And we
gonna
could
have
go
to do
into a
a
whole
whole talk
nother
on
thing
food.
on that.
Okay, we
Yeah.
better stop number
Yeah.
4 at like food and
Oh, I just lost
word,
you.
because food could be a whole like
Oh, yeah, we'll
50-minute
do that.
hour
We'll do
talk
that
on it.
another
We'll
time.
talk about food. We'll break down the foods another time. What would be number 5 for you?
Um, this actually kind of falls into food, but it's an easy one is stop drinking liquid sugar. Just stop. That's huge. It's horrible. Dr. Lustig had to do 2 liver transplants on 15-year-old children who were over 400 pounds each, who had destroyed their livers with soda. So that's not something I'm making up. He talks about it in his book, and it's a real thing. And I just know too many people who think, well, that's just my vice. Well, it's killing you. It's
Yeah.
literally
Yeah.
killing you. So that would be, I know it
Yeah.
falls in the food line, but that's a grab and go. So cut that out. Cut and get back to the hydration of water, like Jen said. And
Oh
then
my
what
God.
would be our 5th one?
Oh, well, you kind of added that into the food one. Um, Just basic lifestyle habits of like how are you sleeping? What are you like how many hours a night are you sleeping? Are
Hmm.
you practicing self-care practices? That could be a whole nother call on
For
its own
sure.
as well, right? What are you
For
doing to
sure.
take care of
Yeah.
yourself and bringing that because you can't avoid stress in your life, and stress can increase blood pressure, stress can increase blood sugar, stress can be a whole conversation of its own. And so if you're not doing self-care practices, you can have metabolic dysfunction in your body just from stress alone. So it's how you manage stress because stress is unavoidable. I would
Yeah.
love to tell you there's no stress in my life, but I was
Mhm.
at the passport office this morning and that was that was a whole nother experience. But like seriously, we all have stress in our life. Stress is unavoidable. If you don't have stress in your life, you probably aren't living.
Yeah.
But we need to learn how to manage our stress and how to run the stress through our body, which I think we should do a whole talk on stress
Sure.
management as well.
Yeah.
So, anyways, we've got lots of topics. If you guys have extra topics you want to add for us, we are going to go through and go through. I see that there was some questions unanswered, but we are up at our time here, so we got to close this call. So we'll come back to your questions. We'll answer your questions on the chat. If you have topics you want to hear from us, coming in the next, remember Tuesdays and Thursdays at 2 p.m. Mountain Standard Time, 3 p.m. Central. We'll be back on Thursday with a whole nother topic. Maybe we'll tackle the food. We got to talk and see what we're
That's
going
a
to
big one.
tackle.
Yeah. I love it. I love it, girl.
Awesome.
Well, I look forward. This is fun to do with you. And I'm so glad that we're getting these words out to everybody, to empower everybody.
I
So
love it. I love it. And if you go out and get that book, share with us because we'd love your thoughts on the book. We maybe will have to collect and do like a mastermind or a book club thing with this
book
book.
club. Yeah.
I think that'd
Okay.
be fun. We got to talk about that. Maybe a book club with this. That could be actually really fun. We could do a whole workshop. Okay, we're going to talk about that. We'll come back and we'll be back here on Thursday. Have an amazing day, everyone. We'll see you Thursday.
Bye
Bye.
now.